Florida recently proposed a change to the form that high school athletes must fill out with their medical provider in order for them to participate in high school sports. In particular, they were wanting to make mandatory specific questions about menstrual cycles. Lots of people protested. Let's talk about it. Hey everybody, it's Dr. David from not so warm Florida this morning, thus me wearing the flannel. But yes, some interesting stuff went down this past week regarding this school form that needs to be filled out. Now, of course, there's always been a form that needs to be filled out for athletic participation for high schoolers, and there would be a series of questions that they would fill out. They would present it to their medical provider, who would then decide whether there was anything in particular that warranted further investigation, examination, testing, specialties, etc., in order for them to move forward and to participate in the sports. Now, parts of that form was to be kept on file, and only part of it would be to be turned in. Now, the Florida High School Athletic Association. There's a committee that comes together that makes these types of proposals. And they wanted to make mandatory questions such as, when did they start getting their periods? When was the last period? And how often the cycle was occurring? Lots of information that's private there that really nobody besides a patient, their family, and their medical provider should be knowing about. But yet they were wanting to make it from a alternative that it could be put on the form as an optional question to making it mandatory. Now, lots of people felt that this was an invasion of privacy, that just because of when a woman, this is a natural thing that young women get. Why are we asking about that? There certainly weren't asking questions such as, do guys have any issues getting erections or anything like that? So why they were asking about a normal health process, that raised some significant concerns. And in all honesty, because of what the state of Florida and the governor here, the legislature has been trying to put forth, and has already passed in terms of both in terms of the transgender youth issues and participation, etc. There were people who were wondering, was this a way of them finding out, maybe in a backhanded way, around the block kind of way, of determining whether an athlete was actually a transgender female, in order to try to participate. Now, that wasn't specifically said by anybody, but certainly that was suspicions that were being raised. Now, because of this, I did look into deeper, because I saw headlines that said DeSantis wants to know about girls' periods. So let's first of all set the record straight. And this was something that was fact-checked by the AP. That is not actually what DeSantis had called for. In fact, DeSantis himself wasn't involved in this decision, because the Florida High School Athletic Association is actually a a private non-public organization. What do they refer to? It's a nonprofit organization, excuse me, that specifically comes together to make these types of decisions. Now, the education secretary for the state of Florida, the commissioner, is involved in this, and also there are members that are nominated by the governor to this committee, but it is considered an independent, nonpartisan, nonprofit type of organization that put this together. Now, after a lot of protests on this, they decided that they would have a new meeting. It was an emergency meeting that was called for last week in order to discuss this further, taking this optional questions and making it mandatory. Well, there was a lot of protests, as I mentioned, and it turns out that I guess they were convinced enough that they decided not only to not go forward with adding these as mandatory questions, they actually decided that they weren't going to even ask these questions whatsoever. Yay! Thankfully, some respect for autonomy. Thankfully, respect for individual rights and wishing to share private information. So I'm really glad to know that they actually did this. Now, it's the job of a provider, a pediatrician such as myself, to ask those types of questions. Of course, with an athlete, we want to make sure, are they having their periods, because that could be a sign that they have that they may be having anorexia, bulimia, that they may be having other types of eating disorders, which can be manifested that way. Of course, if they're underweight, they may not be safe in order for them, or a lot of times dehydrated, it may not be safe for them to participate in sports. But when these questions came up, it kind of struck a note for me, because, yes, we fill out on the form, is there a history of seizures? Okay. But they're not asking, what kind of seizure do you have? How often do you have your seizures? When was your last seizure? Again, those would be the same types of questions, and that's not part of this. Now, it also should be pointed out that this wasn't just Florida doing it. In fact, some states already have those as mandatory questions, and other states don't have them at all. But it is important to know that this was not just a Florida thing. Now, of course, if I had an issue and I was concerned about a woman's and a young woman's menstrual cycles, if I couldn't figure it out, I'd want to have a women's medicine doctor be able, an adolescent medicine doctor, to look over us to see what these things are going on. But overall, the big story is wasn't quite clear as to why they wanted to do this in the first place. But more importantly, they decided it wasn't worthwhile going, or that it was an inappropriate thing to do. So hats off to the people who made that decision. Thank you for respecting people's privacy. Have a nice day.